We're joined now by the former director of the HHS Civil Rights Office, attorney Roger Severino. He's now a senior fellow at the Ethics and Public Policy Center in Washington, D.C. Roger, it's great to have you here. Let me ask you about the pandemic. When COVID hit, your office released a series of announcements around age and disability discrimination, calling out specific healthcare providers and facilities in states like North Carolina and Texas. What was going on?
Well, when things get tough and you start running out of resources, it makes some hard decisions that are put on medical professionals as to who's going to get care. Unfortunately, some stereotypes crept in, and we saw some states with plans that would say that people with certain intellectual disabilities would not get treatment. They would not be given ventilators, for example. In one state in particular, they actually had a restriction where if you had a mental disability, they called it severe retardation, using the old language, you would not be able to get a ventilator. And that is just a gross violation of civil rights, seeing that some lives are worth more than others based on abilities or disabilities. And that was just wrong. We stepped in and said that violated federal law, and state after state changed their policies for triaging during COVID.
Well, thank God for you. The COVID pandemic also brought coercive actions where families were sometimes forced to sign do not resuscitate or DNR orders. And your office had a draft rule that addressed this, as well as these state standards of care you were talking about. Is there any chance protections like this might still be passed? It's a draft rule that you left on the books, right?
Yes. Well, I literally left a draft rule with a bow on it the day I left. That was the one thing that I thought, you know what? We have a change in administration. We can at least agree on the fundamental dignity of people when it comes to disability rights. I'm hopeful they will do it. We had two rules, one based on making sure infants, newborns, were not being abandoned and left to die because of disabilities. We've had some heart-wrenching cases of that. And more broadly speaking, in the allocation of medical care, whether it be for transplants, we do not deprioritize people based on disability. And additionally, on the issue of assisted suicide, where we don't just channel people with disabilities into life-denying care instead of life-saving care. I'm hopeful the Biden administration will pick up that baton and take it to the finish line.
You just touched on something really important that attorney Steve Gold discussed with us earlier, this issue of doctor-assisted suicide. And California recently passed a law legalizing this practice. Was this an issue that was raised to you in your capacity in the Civil Rights Office by disabilities advocates?
Absolutely. When you think about life and death issues, that's often when people with disabilities are at their most vulnerable. And people who have disabilities, by definition, under California law, for example, are the ones that are eligible for assisted suicide. You have to have a terminal illness, which is per se a disability. Why not make sure that we present them with life-saving options if they have suicidal ideation, making sure they have the counseling, the psychiatric, the psychological help they need, instead of just going with the oftentimes cheap option of saying, here's a pill, will help you end your life. We value every life. We don't want to rush to end people's lives, especially those with disabilities who are often pressured even by family members sometimes, to be seen as a burden when they are in fact a treasure.
There are a lot of pressures on religious doctors and religious nurses right now. Is there anything that you see that could be done to protect them when we need them most in the middle of this pandemic?
Sure. Unfortunately, there has been an assault on religious liberty, especially with our frontline doctors. Religious liberty is what drives people in many cases to enter the practice of medicine, and they don't just cast off the religious faith. Again, when it comes to the issue of life and death, people don't want to be forced to assist in abortions. They don't want to be forced to assist in suicides. They will be driven out of the medical practice unless we have strong protections for conscience. And those people are the ones we need more than ever during this crisis. People are willing to sacrifice everything, even sometimes take low pay and work long hours because they're driven by faith. They should be welcomed, not rejected.
Circling back on your comments about the Biden administration, do you think that they will make good on their promise to continue to protect disabled Americans?
I certainly hope so. I have not seen the focus that I think is required. We spent a lot of time and effort making sure that disability rights was included in everything we did, especially during COVID. They've issued some guidance, but I'm hopeful that they will be more focused. Unfortunately, their focus has been on a lot of hot button social issues, on gender identity, and on abortion. I wish they would spend some more time on disability rights.
Well, thank you, Roger. We'll continue to watch this issue carefully.
Thank you.